No. Good afternoon. Mr. Gill.
Thank you, my Lord. Lord, the next witnesses are 4 members of the Care Home Relative Scotland group. They are Catherine Russell, Sheila Hall, Alison Leach and Natasha Hamilton. They have asked if they can give evidence together in this way. They are used to doing that, I think, from various occasions on which they've given presentations to, including parliamentary committees and other groups. I have exhorted them not to talk over each other, and I think they're accepting of that. But perhaps if we can just go through so that everybody in the room and those watching knows who is who. Mrs. Russell.
I'm Cathy Russell.
Yes, and I think we know you were born in 1995. We don't need your precise date of birth, which means that you're probably the same age as me. In that case, you're 68. And the inquiry is aware of your address, but for present purposes, I think the group is designed care of your solicitors, Thompson's. Mrs. Hall.
That's myself.
Yes, and you were born in 1959.
Correct.
And again, your address is known to the inquiry. Miss Leach.
Yes.
You were born in 1977. And Miss Hamilton, you were born in 1986. Right, thank you. You are, perhaps this is probably not something you actually need to answer to, but you are 4 of the core members of the Care Home Relative Scotland group, CHRS, as it's known, and you've indicated a willingness to provide a statement to the inquiry in the form of what we are terming an organisational statement, in which you talk about the way in which CHRS has acted and campaigned over the past few years. You're in agreement that your statement is published and is available to be considered. And for the reference, my Lord, the inquiry reference to the statement is SCI WT 0731 and then 501. Looking at your statement, if we could go to paragraph 3, it'll either be in front of you or be on the screen in front of you. I think you indicate there that you're prepared to provide the statement and you would wish to all speak to it. And you can each speak to different parts of the statement. While you indicated when the statement was written that you thought it may not be possible, we have done our best to accommodate your wish on that matter. And you've also provided the inquiry with a lot of documents, some of which we will be referring to today, but a lot of documents you have given to us, and as with all witnesses, I will indicate that all documents that have been provided will be considered and analysed by the inquiry team and taken account of. At paragraph 5, you talk about the group, and you set out the aims and objectives of the group, which were written in September 2020. And I wonder if somebody from the group, I think it's probably Mrs. Russell, would you like to read out what are the aims and objectives of the group?
Yes, we set out very early on exactly what we were trying to achieve, and that was to enhance the quality of life of our loved ones in care homes by resuming essential family contact, by working to introduce the concept of essential caregiver status within the Scottish visiting guidelines for care homes, to encourage a person-centred approach, enhancing and supporting emotional well-being and avoiding further social isolation, and thirdly, to develop lines of communication with policymakers and represent the views of relatives with loved ones in care homes. We did this because we were very conscious that when we set up the group, there was a huge outpouring of emotion. We were absolutely, we had all been struggling individually, dealing with the fact that we had been cut off from our relatives for so long. Some visiting guidance had been published, but it didn't vaguely resemble how we would normally have spent time with our loved ones. And we were starting to see pictures of people sitting, 2 metres, 3 metres away behind police tape and so on. And we thought we really wanted to work positively with the Scottish Government to try and get some common sense back into this, because we felt that the measures that were being taken were so detrimental to our loved ones.
And you say at paragraph 6 that the group does not and has never received any funding.
That's correct. We were set up essentially as a Facebook group, so we didn't need funding to run that, and we have really just kept it. We've found that there have been advantages in not being funded by anyone.
And you have over 2,000 members.
That's correct.
Yeah. Now, what you say in paragraph 8 is that the group was brought together out of sheer desperation and desperation to get access to loved ones in care homes. And you then go on to say, when you were founded, which was on the 12th of August 2020. And can you just explain how you all came together?
I think I had noticed people on Facebook. I'd also been aware there were petitions going round. One of those petitions had been founded by Natasha. There was another petition by another lady that I'd signed, and I'd met a few people on Facebook who were making the same observations as myself. And so I just messaged people, and very quickly the group grew really, really quickly. I think people were desperate to find somewhere they could coalesce and take this forward.
Yes, and I think in paragraph 9 of your statement, you do individually set out the connections that you each had with somebody in a care home. And again, it's not necessary to go through those in detail. We are aware of that information and obviously have noted it. There is also a mention of a lady who had a daughter in a care home, and she became part of your team. Now, I don't want you to mention her name or the daughter's name, but that was a slightly different situation where you had a person whose daughter was in a care home rather than somebody, if I can put it this way, elderly.
That's right.
Yeah. And at the bottom of paragraph 9, you say that you were all concerned about visiting guidance and the lack of contact with their loved ones in care. Now, we're talking about when your group was established in August 2020. So what was the nature of your concern?
I think at that point, things were opening up in society for the general public. You could eat out to help out. There was travel corridors, but there was nothing meaningful changing for care homes. It was as if residents had just been forgotten about. And that was really the driver. I could see my friends going for lunch with their mum. They could go on holiday with their mum, but I couldn't have any meaningful contact with my mum. And that was really where the frustration came from, that nothing was changing for residents.
Mm-hmm. Mm-hmm. Yeah. And was, I can put it this way, perhaps a feeling of unfairness, was that something that you experienced when you saw others who were able to interact with their loved ones?
Yeah, I think that's the basis behind also why the group was set up, and that's certainly why, in paragraph 9, why the petition was set up. I found it very unfair in July 2020. Yeah.
And Ms Hamilton, you are the daughter of Anne Duke, and the concept that we will come to look at of what's called Anne's Law is named after your mother.
Yeah, that's correct.
Right. Going back to paragraph 10, your Facebook group, who is the originator of the Facebook group?
Well, I was the one who physically set up the group, but as I say, I was already in touch with people who could immediately join it, and we shared shared it around community organisations and so on, so that people were aware of it.
Mm-hmm. And it appears that that group started to expand quite considerably.
Yes, it did. There was a huge, it was like a pressure cooker, really. I think people had been very distressed at being cut off from the people who were a huge part of their lives. Once the group opened, you realised, particularly husbands and wives. I mean, we had a lot of husbands and wives who'd been together for 40, 50 and more years, and they were no longer being allowed to see each other. They could just look through a window. And this was a time where, had their husband or wife been in hospital, they could have sat and held hands with them for an hour every day, because hospital visiting had been re-established indoors, but it hadn't been re-established in care homes. And people felt very, people normally when they go into hospital, it's only a short time, but we had been cut off since March, and were not being allowed to establish any kind of reasonable contact or meaningful contact with our loved ones. We were left standing, in my case, even when open visiting started, like outdoor visiting, my mother was kept in the home, and I would be stood several metres away shouting at her through open patio doors. And that wasn't how we spent time together, and that was the case with, I think, everyone in the group, that they couldn't do the things for their loved one and provide the companionship and the love and the touch that they had always done.
Yeah, was that something that resonates with all of you?
I think there's this misconception about who lives in care homes. It seems that people think it's 90-year-old bedbound, severely demented people that are in care homes that don't know if they get a visitor, whereas that's not true. There's a huge population from the age of 18 right the way up that are in care homes, and they can have very fulfilling lives that are still involved with the community. They can be very active. They can still have fulfilling lives. And I think the members all felt quite isolated. You don't know what it's like to live with a loved one in a care home unless you actually live it. And I know from my own experience, a lot of people just kept telling me, but your mum's safe. Nobody else was taking account of the other harms that were happening of her being isolated. So by Cathy starting the group, it brought everybody together, and it was this sense of relief that you were no longer alone in feeling like this. Because if you don't know somebody else that's living that life, then you are very isolated.
I think it's kind of important to emphasise how once we all came together, we appreciated how we'd all been in the same situation, that feeling of isolation and frustration, and we'd all been individually just desperately trying to find someone in authority to write to or question or find out why the guidance wasn't improving. And it was almost, when we came together, it gave a sense of community and power and momentum when we started then contacting the different bodies.
Well, what you say in excuse me, in paragraph 10 of your statement, just midway down that paragraph, you indicate people that you got in contact with. That included the Scottish Government officials, and other bodies, including campaigning groups. You contacted MSPs from each political party, Scottish Human Rights Commission, the Mental Welfare Commission, Human Rights Consortium Scotland, Scottish Care home providers, Public Health and the Care Inspectorate and Alzheimer's Scotland. So you became very active in putting out your case to a wide variety of government agencies and other agencies which had an interest in care homes.
And we very quickly formed a logo and kind of presented ourselves in a professional and official way. So that
well, I think somebody has or had some involvement in PR, so you were able to utilise that
I think,
experience.
I'd certainly worked in corporate communications, but also Natasha was heavily involved in marketing and so on. And I think throughout the group, not just the core team, but all the members, we did have a lot of people who brought a lot of skills that we could use, for example, in developing all the surveys and in carrying out research and so on.
And in paragraph 11, you say that the group started to think about how they could progress matters and bring the plight of care home residents to the public's attention. And as the reference to the background in PR. And you thought that a demonstration would further the profile of your group. Is that right?
Yes, well, we had been sending lots of letters, but we weren't getting lots of replies. And not so much as when we were a group, but certainly individually. I mean, I had started sending letters in March, and to say, you know, this situation is going to go on for more than a year. You can't stop me seeing, you know, seeing my mum for more than a year, basically. So I think we knew that simply letters weren't getting us anywhere, whereas a demonstration with placards and so on would generate press attention, and that might ensure that politicians would pay more attention.
Were your letters just being ignored, or were they responded to in particular ways?
Well, certainly, I mean, I can remember sitting with Cathy and making a list of all the directors of public health. There was 14 in Scotland, and writing to them all, and very few did we get replies from. We sent the letters by email, and I mean, we would possibly get an acknowledgement, oh yes, we hear you, but nothing really concrete came out of that. So yeah, no, we didn't get anything.
And I think
Substantive.
Substantive.
Would that be the way to put it?
I think also it's important to remember that at this time there was nobody speaking out for care home residents at all. There was no voice for them.
So you managed to organise a demonstration, which you tell us about in on the section Next Steps of your statement of paragraph 12. And perhaps somebody would read out what actually happened at that time.
Yeah, paragraph 12.
Yes, please.
Yeah. So a demonstration was planned outside the Scottish Parliament for 16th of September 2020, making 6 months from the start of the lockdown restrictions and the last meaningful contact with the relatives in care homes. The group's aim for the demonstration was to highlight the issue and get into conversation with the Scottish Government team who were issuing the guidance.
Carry on.
Yeah. So the police at the Scottish Parliament were notified in advance by CHRS of the planned demonstration. The group asked those attending to follow social distancing guidance and to wear face masks. The media became aware of the planned demonstration, and the group were invited to speak on the Kay Adams BBC radio show in the morning of 16th of September 2020. Members of the group also appeared on Politics Scotland that evening to put forward their position, and also featured on Reporting Scotland. Sheila and Alison were interviewed on BBC Radio Scotland Drive Time, and the demo was covered on many local radio stations. At the demonstration, the group used posters and placards to try and bring attention to the forgotten community of those in care homes. There was a very good media turnout. Members of the CHRS core group have featured in the press and media on numerous occasions. The press...
Can I just stop you there? Because that was obviously on the 16th of September. And it appears from what happened thereafter that you got the attention of at least some politicians. And in particular, you got the attention of Jean Freeman, the Cabinet Secretary for Health. And I think you then were invited to a meeting with her, and you met her online on the 18th of September, so just 2 days later.
Yes,
So what you tried with your demonstration, at least to that extent, had a successful outcome.
Yeah, we got a call on the day of the 16th. I was contacted by someone just trying to check my phone number, and Jean Freeman phoned that day.
Mm-hmm. Right. So, was it the four of you who went to the meeting with Jean Freeman?
At that time, we had just met Alison for the first time at the demonstration, and there was a lot of people there, but so it was the three of us that went, and one other person who was in the core team. And she was an interesting lady in that she had, throughout the pandemic from April, had always been able to have contact with her mum in the care home. So in a way, she was the perfect demonstration of what we were trying to show could happen, could be achieved quite safely.
So what was the outcome of this meeting with Jean Freeman on the 18th of September?
Well, the outcome was like the outcome of most meetings, another meeting, but what they said was they would go away and they would look again at the guidance. She said she could hear what we're saying, that we wanted to meet in a relative's own room rather than outside, that we wanted touch. She summarised everything that we were looking for, and said that we would meet again. And I think it was probably near 2 weeks later that we met. And that's when we heard that the new guidance was coming forward. That would give us 4 hours with touch.
Mm-hmm. So, to an extent, you had achieved something through that contact with Miss Freeman?
Yeah, I think we were all really happy that day, weren't we? That Alison was at that meeting too, and we were just delighted that, you know, we had made progress.
Yeah. And Miss Freeman, I think, did continue to meet you on regular occasions, and you communicated with her and sent her in particular surveys of the impacts that you and your loved ones were experiencing, and others. Yeah. So far as the improvement in that you were made aware of by Miss Freeman in October 2020, did that, or did the advantage in that last?
Not at all, because on the day that we were given advance notice of what might be in the guidance, we were really delighted. But by the time the guidance came out, I knew, for example, it would make absolutely no difference to me because Glasgow had gone into a different tier, which excluded care home visiting. So there wasn't going to be any in Glasgow, there wasn't going to be any in Greater Lanarkshire or Greater Glasgow. And immediately a number of care home groups were saying that they wouldn't be implementing it. So Alison and Natasha did a great deal of work really to establish how well that was going down.
Mm-hmm. And can you explain what work you did and the results of that work?
Yeah, I think after the initial reaction from some care providers about what was being proposed and them saying that they wouldn't implement it, we decided, we had already done one survey at the end of September just to try and quantify what the situation was.
And can I just pause you there? Can you tell me how you did your surveys?
We did it through Google Drive.
Through
Google Drive. It just emphasising how much we actually were just family members, using like what we had at our hands to try and prove to government bodies that the guidance that they'd put out wasn't working. So we felt that we could sit in meetings and talk about it, but we might just come across as a bunch of families that are just getting angry. But if we could actually show them physically, we've went to our members and we've taken information from them, here's the feedback, then we felt like that's something that could really give us the upper hand, I guess, in these meetings and prove what we were saying was actually true.
What was the reaction to that, sir?
To this,
The information that you were providing?
I think on the survey that we carried out a survey from the 27th of October to the 3rd of November, so we gave the October guidance a couple of weeks to be embedded. I think that was the biggest response to any survey that we've had, and that we had 347 respondents, and only 10% reported an improvement in visiting arrangements. So when we were able to feed this back, I think Jean Freeman was quite shocked as to how poorly it was being implemented. 33% of respondents reported that the visiting had actually worsened in the period since the new guidance had been, and 7% reported having a visit that included touch in the 3 weeks that followed the guidance coming out.
Sorry.
Could I just add, because if we strongly feel that if we hadn't done these surveys, no families would have had their, or care home residents would have had their voices heard, how the guidance was being implemented. It was purely asking the care homes, is this guidance working? They were giving the feedback. So it was only care homes that would have had their official voice heard unless we had given this information to the government.
So far as reasons as to why this wasn't working, what did you become aware of?
I think something that we very quickly became aware of was the confusion with guidance. There was guidance coming from so many different places, and so Scottish Government were doing their guidance, but they were dependent on public health guidance. There was guidance coming from CPAG groups, there was guidance coming from infection control groups, and there didn't appear to be one person, one concrete voice giving clear guidance. And we kept saying that to Jean Freeman, we need just clear, simple guidance. But we were trying to plough through this plethora of 32-page documentation that kept coming out. So there was a definite lack of clarity that caused confusion and difficulty.
There was also an implication.
Sorry, please go ahead.
There was also an implication that the reason care homes were so reluctant to let us in was that they weren't indemnified. And
I'll come to that in a moment, if I may. So far as confusion with guidance is concerned, obviously you would be people who were interested in the terms of the guidance so that you could inform yourselves and indeed other members within your group as to what the guidance was at any particular time. Now, you clearly were having difficulty in assimilating all the guidance that was being passed around. Did you find that was a difficulty that was being shared by those who were caring for your relatives?
Oh, without a doubt. Absolutely. I had a very good, well, speaking for myself, I had a very good relationship with the manager in Mum's care home, and she used to be tearing her hair out and would say, oh, for goodness sake, you know, what does this mean? What do I do here? I'm getting this from this and this from this. And, you know, I used to sit with her and we used to chat about it, and I'd say, well, it's actually, we can do this. And she'd, oh, right, okay, yeah. I mean, it was very difficult to follow.
I think one of the indications you mentioned was question of indemnity.
yes.
Perhaps you just explain that.
Well, in one of the letters that I'd sent to Dr. McCaskill at Scottish Care, you know, I had said to him, you know, he had mentioned, I had said that President Macron, had just instructed the French care homes to open in May, and he said yes, but he was able to do that because the French care homes were indemnified against prosecution, and that didn't happen in the UK, and that care homes were finding it very difficult to even get insurance.
Yeah. Okay, we're into paragraph 21 of your statement. There you mention the former First Minister, and you say that she did not meet with the group despite many requests, presumably to do so. What was your reaction to that?
I think we were all very disappointed. The First Minister seemed to meet or send messages out to certain demographics. There was a message to children that Santa was still a key worker. She met with the group that gave evidence this morning. There was the message to students telling them to go home for Christmas one year. It just always felt that our residents were just not on our radar. This was enforced by care home residents never being included in the daily briefings, or when there was updates for the general public. Care home residents were never mentioned in this. We would raise it time and time again, and we raised it at a meeting with Kevin Stewart when he came into post. It was quite a fraught meeting, that one, and at the next update, care home residents were mentioned in with the general public for the first time.
And can I just add on the back of that, one of the only times that care home residents were actually mentioned was in the Christmas 2020, when the whole country was going to go into a lockdown on Boxing Day, and everybody was told you could have a family bubble on Christmas Day, because Boxing Day we were having lockdowns. But the former First Minister stood up and said, unless you're visiting someone in a care home, do not create a bubble. She didn't tell staff not to create a bubble. She told families, if you're visiting someone, do not create a bubble. And that had a major impact on how people viewed care homes and visitors.
Thank you. You did seem, however, to have the ear of Jean Freeman. And I think at paragraph 22, you make reference to another meeting with her, where you explained to her what was going on at grassroots level in care homes. And you say in your statement, for people who did not have a loved one in a care home, they simply did not know what it was like on the ground. So was it your impression that there was a difficulty in the wider public in understanding what the position was in care homes?
I think that they were I think in a sense they were almost believing their own PR. You know, I mean, very early on when they brought in visits with touch, there were a number of press things done, you know, protocols done of people meeting and greeting in care homes. But for the vast majority, that never happened. I mean, I was still sitting behind closed windows, and that was the case of virtually everyone in Greater Glasgow and Lanarkshire, and lots of other parts of the country were simply not getting that type of access to the relatives. And it was very much outdoor visiting only. There were very few places doing any indoor visiting, although there were a few examples, like Kelso House, and there were a couple around the country that did a good job, but not many.
Paragraph 23 of your statement is only a single sentence, and it's very brief, but it contains, I think, what you would see as being a very important observation, and that is that you saw yourselves as, and I quote, essential caregivers. Now, do I take it that for many of you, prior to the pandemic, you were actively involved in the care of your loved ones, wherever they may have been, whether they were at home, whether they were in care homes?
Absolutely, and I think from the very first meeting, we kept saying we are not visitors. They kept talking about us as visitors, and over the years that kind of filtered through, and that was kind of appreciated. But yes, we were not just visitors. We weren't just popping in on a Sunday afternoon once a month. We'd been in virtually every day. And for many of our members, they would have been going in every day to help with mobility, to help with feeding, to help with touch, to help with just general care and companionship. And we keep coming back to the fact that we should have been, anyone in a care home is looked after by a team of people, from the laundry ladies, the cleaners, the carers, the nurses. There's a team that have to look after them, and we are part of that team as the visceral husband, wife, daughter, son, and that's what was never, ever, and still is not being fully recognised. And that's what we mean by being essential caregivers or essential partners or essential contacts.
And also you come to the, if I can put it this way, the exercise of trying to see your loved ones from the standpoint of being a relative, being a friend, in many cases a partner, who loves the person who is in the care home. So it would be rather odd if you were negligent or unconcerned about the way in which you conducted yourselves in that situation.
Yeah, we felt that they really just didn't. I mean, I don't know if it was a lack of trust or what the problem was, but I mean, to us, as Sheila has said, our relatives needed a lot of support around them, and we always recognised that COVID was extremely dangerous to our loved ones, but stopping relatives getting in was not stopping COVID getting in. And I mean, one of the other things that used to upset me at the daily briefings when Nicola would announce the number of people that had died of COVID, she wasn't announcing the number of people that had died in care homes that had never seen their relatives since March. You know, I mean, we were getting people on the group every single day announcing that their loved one had died, and by the end of, after 12 months, more than 15,000 of them had died. And only 1 in 5 of COVID. I'm not saying only, I'm not underestimating in any way COVID deaths, but the point was that, you know, a great many people in care, although the care home population is very diverse and there are young people and there's people with all sorts of different conditions, a very large majority of people who are approaching the end of life, and this is known to be the case, and so people were just completely distraught, and those whose loved ones died before they were in any way reunited with them are finding it extremely hard to cope with that loss.
Did you feel that there was an appreciation, either on the part of decision makers or those who were implementing decisions, as to the detrimental effect on your relatives of isolation?
No. I don't think anyone took that into any sort of consideration. Everybody was just concentrating on COVID. And although we're talking about us getting in, all the restrictions and the guidance that we put in place never put in favour for the residents who were shut off from everything that they were known. I was shut off from seeing my mum, but I could still speak to my husband, I could still make phone calls, I could still go to the shops, but people in care homes, people in care homes didn't have that option. So the isolation just heightened that, and I don't think anyone took that into consideration. They didn't take any pre-existing conditions, reasons why anyone was in a care home. All they were thinking of doing was protecting them from COVID, and didn't listen to any of us when we said the reasons why they're in care homes are worsening because of the isolation.
And the alternatives that were offered, such as a window visit or an iPad, and I think it's a large percentage of people in care homes have a cognitive impairment. That is not going to work for anybody in that. We probably never used iPads to communicate in care homes prior to this. So suddenly you've got a voice coming out of somewhere that if the person can concentrate on the iPad, you're lucky, but if they're not used to that, it could well cause distress. we had people, sometimes the window could be open, sometimes the window could be closed. You could be stood at a closed window with a mask on, trying to communicate somebody with a cognitive impairment. It didn't feel like anybody had thought this through, of how any kind of meaningful contact could be maintained.
Going back to your statement, because I think some of what you've said is really anticipated in some of the next paragraphs of your statement. At 24, you say you were not campaigning for open door access. And you make the point that many of those in your positions were people who had cared for their loved ones prior to them being in care homes. You also refer to the essential caregiver status, and we'll come to that in a little. And I think really in 26 you encapsulate what has been said. Perhaps somebody would just read that out so we can have it from one of you. Paragraph 26.
CHRS were concerned that Scottish Government and their public health advisors saw COVID-19 as the only harm. They did not consider the trauma and the effect on mental health that enforced separation from loved ones would cause.
Right. At paragraph 27, you go on to indicate some of the work that your group has been engaged in since the start of the pandemic. And again, it's perhaps useful just if somebody reads that out.
Since the start of the COVID-19 pandemic, CHRS have had in excess of 130 meetings with Scottish Government and decision makers. Following the initial meeting with Jean Freeman, these then took place at regular intervals via Teams on the computer. After the Scottish Parliament elections in 2021, contact continued through Kevin Stewart, Minister for Mental Wellbeing and Social Care, and still continues with Marie Todd, Minister for Social Care, Mental Wellbeing and Sport. Meetings have also been held with the Care Inspectorate and Scottish Care, as well as other organisations, which are detailed on a spreadsheet provided.
You provided that to the inquiry, and
Correct.
we're aware of it. You also gained some awards for your campaigning work.
No, we haven't won any yet.
We were nominated.
I'm sorry.
3 times the price.
I am anticipating what may happen. You've been recognised.
Yes,
Been finalists.
we were finalists.
Finalists. I apologise for that. And you list those for us there. And you have also been active in giving presentations at events to a very wide range of bodies, and you list them as NHS Lothian, Scottish Care, TUC, Infection Prevention Society, and the organisation Tied Together in Dementia Every Day. Now, the next section in your statement is on inconsistencies, and this is something we've probably already touched on briefly, but again, I would like you to take us through that. And given that Ms. Leach is the person mentioned in paragraph 30, perhaps you would just read that section so that we have it.
Sure. Following the improved guidance in October 2020, I was asked to take part in a trial involving visits with touch. 3 of these visits took place prior to them being halted by the care home provider. The reason that was given was that the provider felt that these types of visits were too risky and that the government had made the wrong decision. One major concern of CHRS was that that when the guidance was published, it was the responsibility of the individual care home managers to interpret and implement it. The guidance was not clear, and individual care home managers would often err on the side of caution. And CHRS heard reports of some Scottish care homes applying English guidance.
Continue, please.
The group is concerned that care home managers and Public Health Scotland were giving insufficient reasons as to why relatives were being excluded from care homes, often simply citing infection control measures as reasons for refusing visits. Relatives have no right of appeal to these decisions. The group was often asked for their views on the guidance. They played an extensive role, including commenting on and suggesting edits for all versions of the Open with Care documents. The group has also reviewed guidance produced by Public Health. In order to clarify the confusing guidance, the group often produced their own summary documents to provide clarifications for our members.
Right, can I just stop you there? From this section of your statement, again, did you gain the impression that inconsistencies and confusion were inherent in the way in which you saw the guidance being operated, but also was inherent in the way in which it was actually being operated?
Yeah, I think certainly from our members' point of view, there was an inconsistency across the country, that we would call it a postcode lottery. So that played a big part on the frustration that relatives felt that just because your relative was in South Lanarkshire, you're getting different access to someone that was maybe in North Lanarkshire, and that added a lot. So that added a lot of confusion within members as well. So like, well, why are they getting in differently than I am? So yeah, that's always a big thing I think was inconsistent, was between different public health bodies, and depending on where the care home was, depending on the access you got, or depending on the provider was as well, depending on the type of access you got. So the guidance was interpreted sometimes to possibly benefit the care homes.
Just to go back to paragraph 34, the observation is made there that relatives had no right of appeal to the two or of these decisions that were made by individual care homes, and that I think is in the context of decisions often being said that access would not be permitted for infection control reasons. Throughout the pandemic, did you ever find or get the view that any decisions were being personally framed or had regard to the personal rights of your loved ones?
No, we felt the rights of our loved ones had been completely trashed from day one, and we felt our rights had been completely trashed from day one.
No. It wasn't just your loved ones, it was yours.
Yeah. You know, I mean, and we think that even if you look at the existing care standards which were in place before the most recent care standards, all of those were breached. I mean, no one asked my mother, would she, you know, what would her preference be? You know, would she rather take a risk with a virus and see her family? And, you know, I can absolutely 100% guarantee what she would have chosen. And also people in care homes had actually been incarcerated. I mean, I remember my absolute rage in September 2020 when the poor students were, and I do feel sorry for the students, but the students were absolutely up in arms that they'd been closed in halls for a week. Our relatives had been banged up since March, and there didn't seem to be anyone in the human rights community, anyone anywhere, actually calling this out. And this was including young people, you know, it wasn't all, and likes of my mum. I mean, every time I went to the home, I took her out, you know, in her wheelchair. But all of that was gone, and yet everyone else was encouraged to go out their daily walk. I actually had a call from one care home, from a relative of a care home, where they said a gentleman had committed suicide because he normally walked the promenade near his home every day, and that had been stopped. And 6 months in, that man took his own life. And this is what we were up against. And I mean, I did tell Jean Freeman about that and gave her the details. But it was a dreadful way to treat people.
Right. Paragraph 36 makes reference to an open letter which was published in the Nursing Times in October 2020. signed by a number of infection prevention control specialists and consultants. And I think this is something, this letter came to your attention. Is that correct?
Yeah, we were busy saying, look, with the same infection prevention control measures as the staff, why can we not get in to see our relatives? This was our plea. And then I was made aware of this letter. I've got a nursing background, and it had been placed in the Nursing Times. They'd published it by this consultant called Jules Storr, who's a specialist in infection prevention and control with a nursing background. And it was signed by many prominent members of that community. And it turned out I knew one of the authors, and so I got in touch with Jules and the other author, the other main author. And it was like a light bulb moment, because they were seeing with their professional hats on exactly what we were seeing, that surely we could have contact with our loved ones using good IPC. And Jules's mantra was that IPC should be used with compassion to enable meaningful contact and not as a barrier. So as a group, we worked with them, with a web designer who gave her time free of charge, with a graphics person from the World Health Organization, whom Jules had done a lot of work with. She did consultancy work for the World Health Organization. So we worked really hard to bring together documents and a website which we called Enable Safe Care, which still holds its domain name and is up there that anybody can look at. We produced documents to say, this is how you can use infection prevention control measures and be able to visit your loved one safely. This is how you could safely take them out in a car. This is how you can safely go to their room. And it received a really very positive feedback. We sent it to the IPC consultants in Public Health Scotland. We gave it to Scottish Government, and people would say, oh yes, it's very good, but it was never formally recognised or adopted. It did get recognition, interestingly, from the National Library of Scotland, who very soon after it was published contacted us and said, we'd like to use this as part of our COVID collection, or whatever it's called.
Could we have a look at that letter, please? That's the letter, the open letter in the Nursing Times. The reference is SCI-CHRS 00014, and that will be brought up in front of, on the screen. And as I think we can see on the at the end of the letter, it was signed by Jules Storr and a number of other past presidents of IPS. What is IPS?
The Infection Prevention Society.
Thank you. And also by a considerable number of others, as you've said, who have, at least on the face of it, a lot of experience in these matters and expertise.
Yeah, and I mean, I don't know if this is relevant, but just a couple of weeks ago, I collaborated with Jules at a conference for infection prevention control, a national conference in Manchester, with her saying, coming back to saying that IPC should be used as an enabler and with compassion. And I was there speaking about what had happened in care homes.
Mm-hmm. Let's look at the terms of the letter. At the beginning, we see the writers saying that restrictions are being imposed in relation to COVID-19 across too many nursing homes, nursing care and residential homes in the UK and beyond, in the name of infection prevention and control. And then as experts in this field, and together with interested and concerned individuals and organisations, we summarise why infection prevention and control should be an enabler and not a barrier to compassionate human interaction in nursing care and residential homes. And as a broad concept, is that something that with which you are all in agreement.
Yes, absolutely.
And I think the writers go on to say it is almost impossible to underestimate the harm and mental anguish that barring entry to nursing care and residential homes has caused to thousands of residents, their families and significant others. Such action also supports the dangerous narrative that elderly and vulnerable people matter less. Is that the impression you had?
Yes.
Then the writers go on to say that there is an appreciation of the seriousness of the disease, and they then say that that from, as they put it, from a scientific perspective, it is possible to both protect people from infectious disease through infection prevention and control, while enabling safe, compassionate human interaction, including physical contact between loved ones. So this would have been manna from heaven for you when you were.
Absolutely, yeah. It was a huge
incentive to everyone.
Incentive, yeah. And perhaps we'll come on to this, but unfortunately that's the way of thinking that public health have never adopted. They've never taken a positive approach saying, okay, let's use the infection prevention control measures to work with you to enable you to see your loved ones. It was always, no, you cannot.
Yeah.
I think we also have issues with the way guidance was written generally, in that it always included a kind of sword of Damocles which dangled over the manager's head, because it always said in the end, that at the end of the day, it's entirely up to a manager to ensure it's safe. And so very often you were having, managers, we've got huge compassion for the staff in care homes, and we're extremely grateful to the love and affection that they gave our loved ones. A lot of them were absolutely brilliant. But I think that the way, I think they could have done, I think they would rather have been told, you do these things and we've got your back, whereas they were between a rock and a hard place. If they did what we would think was the right thing and anything went wrong, then they were going to get hammered. There would be Operation Copper, would be knocking on their door, to interview them. There was all these things going on, and we just felt that although the government was, in a way, looking like the good guys in the guidance by saying, oh, we'll allow all of this, they were then just putting all the onus on people. And so in some ways, we weren't overly surprised that we didn't always get they were quite reticent about enabling contact.
Yeah. I mentioned in my opening statement to the inquiry on Tuesday that I had read a statement in which, and I can't remember the precise words, but a health professional who also had experience of knowing somebody in a care home said that there was too much emphasis on what she called the hard stuff and not enough on the soft stuff, which she mentioned spiritual and compassionate. I take it that's something that you would agree with.
Yeah, very much so. You have to, at the end of the day, think, what is life for? That's, if you were 90 and you were in a nursing home, would you want to see your family? And we were only asking for one person who could then try to, who would stimulate their memory and show them photographs of their grandchildren and their great-grandchildren, how they're all doing. That's all we were wanting. We weren't demanding that people come in with a cast of thousands. And yet, they just didn't ever seem to recognise that love is and affection of your family is as much to you as food and drink. It's every bit as important.
And I suppose in many ways the writers of this letter put it probably better than many could, in the final paragraph on that first page, where they say, we know that in a lot of cases people are simply trying to do their best within the resources and circumstances they face, and we would like to help them. Therefore, we now call for urgent action to end what we perceive to be incorrect application of infection prevention and control, often disproportionate to the realities of nursing. And again, that reflects the position that you've taken and are taking today before this inquiry. Around 3 o'clock, I wonder if my Lord would want to
Surely.
take a few minutes.
We'll come back at 3:15. Thank you.
Yep.
Yes, Mr Gale, when you're ready.
Thank you, my lord. Can we go back to your statement, please? And reference. We were looking at the letter in the Nursing Times, and I think that document is and has been in front of you. Obviously, we can all read the document, but I think we can see in the document that the writers draw specific attention to certain matters. And while again we can read them, there are one or two that I'd just like to highlight with you, because I think you've really made reference to these, but I just want to obtain your views on it. The second bullet point, infection prevention and control should instead be used as an enabler and a supporter of safe entry to homes. And that is, I think, the basis of all your respective views.
Yeah, if staff can go in the same way, then we should be able to go in the same way.
Yeah. And third bullet point is quite interesting. It says, the longer the current situation prevails, the more likely it is to become routinized, and de-implementation could become a concern in the future. Is that something you found?
Very much so. I mean, from day one, we kind of realised that how long is this going to go on, because you couldn't see what the strategy was. You couldn't work out what are they waiting for. Are they waiting on a vaccine? Are they waiting on treatments? Are they waiting on better infection? You just couldn't work out what it was going to take to get us back in. Yeah. And in the end, and for many of us, particularly those in Greater Glasgow and Lanarkshire, it did take a year to get back in. And by that time, we'd been double vaccinated, and there was testing. Mm-hmm. So, but if that hadn't came along, would I ever have got back in? I don't know. So to us, infection control was the only thing that would work, because we always knew that there could be changes to the virus, that things might not work, the injections might not work and so on, the vaccines might not work. You would get changes going on, and so for us the key thing was always infection prevention and control.
And what is written there, we took this to the senior infection prevention control nurse in public health, and she agreed with this. So they were agreeing with the concept and what was written in this letter, but to this day nobody grasped that concept. Nobody seemed to have the authority to grasp that concept and come along in a positive way and say, here we are, this is how we can help you become that essential contact person. And to our mind that was perfectly simple, but there was that person was lacking, that authority was lacking from public health, from wherever.
Did you feel that the force of what was being said in this letter was being understood by some of the officials, the people with whom you were discussing it with?
I had email correspondence, or the group had email correspondence with the senior infection prevention control nurse at the time in public health, and she said yes, she agreed with the letter, and she agreed with our work that we'd done as Enable Safe Care.
Mm-hmm. Right. The two other bullet points at that page I think are really, from what you've said, self-evident. Infection prevention and control and compassionate care are not mutually exclusive, and also infection prevention and control should be applied as a source for good.
Correct.
The letter then goes on to address, I suppose, a number of potential recipients of the letter, and it begins with the nursing care and residential homes. And I think we can see there is that the suggestion is to allow normal family interactions by stopping restrictions and instead continue to inform and support families on the steps to take for safe contact in a spirit of trust and cooperation. Now, again, I think you've already mentioned this, but the impression that I have from your evidence is that those with whom you were dealing did not subscribe to the idea that effectively you could be trusted.
Yeah.
I think that's it in a nutshell. They didn't trust relatives, and in fact, on one occasion, it was said to me it would be all right if they were all like you. You know, in other words, if you know, if we felt everyone could be trusted, and in fact, it's in recent guidance as well, isn't it?
Yeah. I mean, we're a bit concerned because the current public health guidance states that they will restrict visiting during a pandemic if relatives are not adhering to infection prevention control measures, which we find completely unfair. Well, we're interpreting it that if one person breached a rule, then they would
just shut down.
Yeah, close the visiting.
The other potential recipients of this letter are the directions in this letter. Number 2, the government, local authorities, public health departments. And the essence of what is being said there is remove statements that may be seen to justify blanket bans on visiting. And again, that's, I understand, something you are very much in favour of.
Yes, the problem of blanket bans was a constant, really.
There was no consideration given to everybody's individual reason why they were in a care home. You resided in a care home, you weren't seeing your family. That's a blanket ban.
Yeah, and then number 5, families, so directed against your cohort. It says, understand, respect and adhere to the infection prevention and control recommendations requested of you to support the safety of yourself, your loved ones and care home staff.
Yes.
Any problems with that?
No.
No, I think everyone would have been more than happy to do that.
Right. Okay, thank you. Can we go back to your statement? Because we then go on to Anne's law in the statement at paragraph 37. And Ms. Hamilton, this is really your project. And I wonder if you would just read on from paragraph 37, so we have that in the transcript of the inquiry.
Yep, so prior to joining CHRS, Natasha Hamilton started a petition on change.org in July 2020. PE 1841 refers. She publicised this on social media and was directed to CHRS in August 2020 by Rights for Residents, a campaign for care home residents in England. This petition sought to ensure that people who live in adult care homes have the right to see and spend time with people who are important to them. Natasha had been unable to see her mother for prolonged periods, and the petition called for a designated visitor to be allowed into care homes to support loved ones. The petition now has more than 97,000 signatures. It was placed before the Scottish Parliament Petition Committee in November 2020. It received a lot of media coverage, particularly from the Sunday Mail, which contained the name Anne's Law, named after my mum, Anne Duke. Anne's Law was added to the SNP manifesto during their election campaign in 2021. It was also included by Labour, Liberal Democrats and the Green Party in their manifestos. Anne's Law has not yet been enacted in legislation. It has been taken forward as part of the National Care Service Bill. However, CHRS believe that the bill does not go far enough. Section 40 of the National Care Service Bill does not give residents the right to have a designated carer or visitor, but gives ministers, in consultation with public health, the power to make directions to allow people into care homes or indeed to keep people out of care homes. CHRS believes a stronger statement is needed to ensure that at least one essential caregiver visitor will always be allowed into care homes if there are any visiting restrictions imposed. In the meantime, 2 new health and social care standards were introduced in March 2022, reinforcing the rights of people in care homes to see and get support from people close to them. All registered adult care homes are expected to meet these standards, and they are used by Care Inspectorate during inspections. The group are concerned, however, that because Anne's Law is not yet enacted in legislation, there are no guarantees that another prolonged lockdown that would imprison care home residents and deny them any access to loved ones could not happen again. For example, in December last year, Public Health Fife took a decision on Christmas Eve to stop all visits to a care home. This decision was reversed after 48 hours and later admitted the decision was wrong. But families live with the constant fear that they can be locked out.
Right. Clause 40 of the National Care Service Bill is still before Parliament. That's correct?
Yeah.
It's not been enacted, and as yet there is no indication as to when it will be enacted.
No.
And I think you have a concern about it, and you've expressed that concern. Do you feel that what is contained within Clause 40 goes far enough?
Right, I'll hand over to Catherine in a second, but sorry, I just want to maybe add something about the base of ANSLO. The reason why if we're talking about impacts in these hearings, the reason that I personally set up that petition was when my mum moved into a care home, she was told that was a home, that our family had to treat that as a home, and that goes for every single care home resident across the country. So that mirrors what they would have been told at the same time. And that impact that happened to families during lockdown, that they were kept out and care home residents were kept away from their family purely because the place they resided in played a huge impact on why this all had to happen. But Cathy, you're more able to speak about.
The problem we have with clause with 40 is that it basically, the National Care Service Bill is enabling legislation, so there's nothing which says what it does on the tin. What it does is it gives a minister the right to instruct care homes. Now that doesn't fill us with confidence, because we were locked out for a year because of the instructions of ministers on the advice of public health. So in actual fact, I think when that happened to us first time round, it may well not have been legal. What happened to us, you know, I've grave doubts about whether or not it was, and I'm sure if we had managed to get a case to court, we would have won. But the problem was that this clause is, it's just not, it doesn't guarantee us anything, and it would in fact make a situation which I believe was illegal when it happened to us legal, because it would give ministers the power to lock us out or to let us in.
I think what's essential in Clause 40 is the issuing of what's termed a visiting direction.
Yes.
And that would enable, in those particular circumstances, for people to get into care homes. That's
right. Part of the National Care Service Bill is involved with, as you say, is underpinned by directions, and they are depending on a lot of co-production. And to be fair, we have been involved in the discussions around the directions, and we keep pushing on this to try and get nearer to this idea of an essential caregiver, essential care companion. We seem to have a lot of problems with the language. But to give people the right to someone getting in, we're getting closer. But the problem with it only being directions is that the directions can be changed.
Yes. There is no mention in Clause 40, as I read it, of the concept of essential caregiver. Is that right?
There's no mention of that.
No. And as you've just indicated, there is a power to ministers to vary or revoke a visiting direction.
That's correct.
And is that something that you're particularly concerned about?
Yeah, that's, that's not ANSLO, and I will stand up. It's named after my mum, and the only way we will allow ANSLO to go ahead is unless it ensures that if anyone resides in a care home has access to at least one person. Anything that says anything bar that will not go through as ANSLO, and we will make sure of that.
This isn't a revolutionary idea. I mean, it's already been accepted in a lot of hospitals as part of John's campaign, that when a vulnerable person comes into hospital, that their care companion, the person who's their carer, the person who looks after them, usually their husband, their wife, their daughter, can be there with them, as they're admitted and so on. And that's all we're asking for in a care home, that people will be able to maintain that contact.
And I understand your evidence to be that in the discussions around the drafting of this bill, you have had some involvement.
We've had extensive involvement in the directions. Mm-hmm. We haven't had any involvement in the clause. No. We have been told this week that they are looking again at the clause.
Yeah. I understand that. And do I understand in the discussions that you have had, there has been discussion about the concept, the idea, whatever you care to call it, of an essential caregiver?
Yes,
Yeah.
and we've been involved in them rewriting the directions
Yeah.
and editing them. But our perception is that one of the problems is they have to defer to public health, and it's public health who are not keen to accept this concept of an essential contact person.
Yeah. Is it the entire concept of an essential caregiver, so far as you understand, I appreciate that you may not know this, is it the entire concept of an essential caregiver that causes public health or the government problems, or is it simply the definition of that term?
No, it's the concept, I would say.
There's definitely a definition, because there's been many a times in meetings there's back and forth about what should we call it. And it seems like there's a lot of conversation.
Well, that's important. What should we call it?
Yeah.
I take it that you couldn't care less what it's called, as long as the concept.
Yes.
Because to be fair to parliamentary draftsmen, there may be issues in relation to essential caregiver as a matter of language, but that wouldn't trouble you. It's the concept that's more important to you. Right, that's all I wanted to know.
Even, any word, obviously there's also to do with family relationships. We couldn't have close relative because they might not be related. So there are these problems, but companion,
That's the sort of thing I was driving at. The language is plainly something, could be something the drafters could have concerns about.
At the moment, the concept, whatever it's called, is only being acknowledged by public health as somebody that is brought in when there's a pandemic. They've made it essential only visiting, and the person isn't actually end of life, then they might allow an essential contact person in. Whereas that's like at the end of the line, whereas we're looking for the person to be recognised as soon as someone goes into a care home, because it will be the husband, the wife, the daughter, the son, and they are part of that team, pandemic or no pandemic, through thick and thin.
Yeah. So that's the idea, the concept. What it's called is not particularly relevant to you.
Correct.
I understand that. Yeah. Sorry, Mr. Gill.
Well, thank you, my Lord. It's very helpful. What I'd like to do is look at just one or two documents that perhaps inform some of the points that you've been making. You've provided these largely to the inquiry, and can I ask you to look first of all at a letter that you made available to political candidates in the, whatever year it was, 2020 election.
Sorry, could I just say one last thing on the back of what you said?
Yes,
so
please.
when Nicola Sturgeon stood up on the 21st of September and spoke about Anne's Law in their manifesto, she did say that family members they would work to make sure that Anne's Law was that family members would be allowed the same access to care homes as staff. And again, so that goes into the conversations we're having. There's a lot of talk around the name of it, but the SNP manifesto spoke about it being the same as staff, so that just highlights onto what we're talking about there. Sorry.
Not at all. Yeah, I wonder if you could look, please, and be shown a document which is SCICHRS 00039. And I think that is a draft letter that could be sent to election candidates.
No.
I'm sorry, have I got the wrong reference?
37, reference 37.
I'm sorry, it is indeed 37, I beg your pardon. Yeah, 37. That was a letter that you sent as your group to potential election candidates.
We asked members to send it.
At the second page of that, you set out what Anne's Law was asking for, and the principles of that are set out in the letter under 5 bullet points. And then the paragraph after that, you say people living in residential nursing homes, for whatever reason, have been treated differently to the rest of society. And then in the final paragraph, you say, this situation is the biggest human rights catastrophe that this country has ever seen, and I ask you to support Anne's Law during your election campaign. Now, you've mentioned on a number of occasions, and mentioned here, what you term a human rights catastrophe. Can you give us some flavour of what you mean by that?
I think, I'll speak first, sorry, and let someone else jump in. Human rights catastrophe, and I sound like I repeat myself, but all of this is because of where someone lived. And we've stated it, we have so much respect for the staff that had to get put through horrendous ordeals that, due to the guidance and having to deal with families wanting to get in and they weren't allowed to let the families in. But the staff never had any infringements put on them, and they could enter the care home and leave. But those who lived in the care home were so heavily restricted in their lives, which could have been, for many people, the last couple of years of their lives. And that, to me, will always be the biggest injustice of what happened. But I'll let someone else come in on that.
I agree with Natasha completely. I think from my perspective, my mum's human rights, her rights to family life, my rights to family life, they were ignored. My obligations under a power of attorney, those were ignored. The Adults with Incapacity Act, every act that was there to protect my mum was trashed. So that's why I believe that human rights have been trashed.
Right. Again, just to get some more context, I wonder, could you go to the document it ends with the reference 000119. And I think this is a letter regarding the National Care Service Bill in the consultation period that your group sent, and it attached a submission on your behalf to that bill. And just looking at the context of it, you say this submission summarizes the views and experiences of our group members, focusing on Anne's Law and the importance of family contact. We remain concerned that the right for a person in care to see their husband, wife, or other essential caregiver in the same way that they have contact with paid carers is not stated as a right, but simply that the minister has the right to direct. That's the essential element of your complaint of what's in the bill. Yeah. And just looking at some of the concerns in the attached document, I think at the numbered page at the bottom, page 4 of your appendix to that letter, you express a number of concerns. The first is human and equality rights. Then there is the option to suspend designated visits, and then you make certain comments in relation to adults with incapacity. Is that right? If I can go briefly to the summary, and this is perhaps something that you've, in a way, been discussing with His Lordship a moment ago. What you say there is, whilst we welcome the ability of directions giving powers of enforcement to ministers, we continue to have grave concerns that within the ministerial directions for Anne's Law, the commitment to ensure care home residents will never again endure enforced separation and isolation could become diminished within the numerous caveats and possible changes to directions. As we have stated on numerous occasions, being a care home resident necessitates regular and close human contact for personal care arrangements. That essential contact must also continue between husbands, wives, mothers, fathers, family members, or close friends. And then you emphasize, for clarity, we would request that the default position should be that the resident's right to contact with their nominated relative friend at all times, and if necessary, by following any recommended PPE precautions as per care staff. We must be recognised as a vital part of our loved ones' care team. Have you diluted anyway from that?
No, that's spot on.
Okay.
Of course. You require directions, or you consider that you require directions, and you'd like recommendations in relation to directions. But I'm not for a minute suggesting that was necessarily practical for you to do it. But you could have challenged directions that were made by judicial review when they were made.
Well,
this is a lawyer speaking rather than possibly someone that practices. But if the directions are fundamentally in breach of someone's human rights, whether it be yours or the patient, beg pardon, the resident in the care home, they would have been challengeable.
Well, the directions themselves are just drafts at the moment, so you might be giving us ideas for the future.
Well, yeah, but I'm not suggesting that it's necessarily a particularly practical way to go about doing something, because it takes time and costs money as the obvious reason against it. But it is something that could be done.
We would rather it simply, there was something simply enshrined there which said that, you know, that where people are vulnerable in that way.
I suspect this is a point that might be developed by your counsel in submissions rather than anything else. But
is the point that what happened on the run-up to this, hopefully my legal knowledge is, I hate speaking about legalities, but the fact that we were locked out anyway was against the human rights. So we shouldn't have needed...
Well, that's extending this argument a little bit further even than we've got so far. But you may have a point.
Yeah.
Yeah, I mean, there were so many. I mean, even the cruel and unusual punishment. I mean, honestly, when you've seen some of the photographs going up in that group of the way, and stories of the way people were being treated, you know, it was really, really inhumane.
Yeah, I see that.
And heartbreaking.
I suppose, sorry.
You know, I think we do need to bring that element of care is all about relationships and good relationships, and to me what they did just drove a coach and horses between relatives and staff, which should never have happened. We were all batting for the same team. We just all wanted the best. And I think a lot of care home staff have been in contact with me. In fact, with a trade union, spoke to me on Monday about it, saying how they really supported us, because that's what they felt too.
No, I understand your position entirely. It's, as I said, I raised a rather legalistic point.
And for those in care homes who were physically frail but mentally had all their faculties, they were sitting reading newspapers and watching the television and seeing society going back to normal, and they weren't allowed to put a foot over the front door of the care home. So I think they felt very strongly that their human rights were being violated.
Right. There are a number of other documents.
No.
Okay.
I apologise.
No, not at all. There are a number of other documents that you provided us with, and they are attached, and these include your commentary on the discussion paper. There's also a literature review by Care Inspectorate and various other papers that make comment on Anne's Law. I would like to take you to a document entitled Anne's Law Consultation Analysis of the Responses. This is a final report. It's dated February 2022. I'm just searching to find the reference to it. Yes, it's SCICHRS 000124. It's an analysis of the responses to Anne's Law, and part 2 of that document contains the response delivering Anne's Law. Now, within that document, there are a number of observations, and if within the document you go to page 23, please. It's numbered in the bottom corner. And I think we can see these are recording responses that have been made to the proposal of Anne's Law. And I think we can see in relation to question 1, the overall aim of Anne's Law. It said nearly all participants agreed with the overall aim that people living in adult care homes should have the right to see those important to them to support their health well-being. A total of 280 participants responded, with 99% of individuals and 97% of organisations responding positively in agreement with that. And I think certain of the respondents gave reasons for their response, and that's set out under the table in that page. And the main reasons included the mental and physical well-being of residents and their loved ones. Quality of life is paramount. The importance of family connections. The need for residents in care homes to have the same human rights as other members of society. The specific negative impact of the restriction on care home residents with dementia. And again, I take it that those are all reasons with which you are in agreement.
And I would also add the negative effect on not just the resident but their relative, the
Yes.
husband or the wife or anyone that was denied access.
And then on what is page 25, there is a response to question 2, which are the opinions on the main aims of Anne's Law. And it says nearly all 278 of the respondents to part 2 of the consultation provided a response on the question of the main aims and the issues raised, and I'll just deal with the first one, if I may. The need to protect human rights and ensure that meaningful contact is enshrined in law. Again, that's something with which you are wholly in agreement, I take it.
Yeah.
So, looking at Anne's Law as it currently stands at the moment, are you optimistic or are you pessimistic about it?
Okay, at the moment I would say I'm pessimistic. I like to be optimistic about the interaction we're having to discuss about it. The reason why I'm pessimistic is something this simple should not take this long to get put through in law. So we clearly have someone somewhere that's putting a barrier up for us. And if it's taken this long to get us to this point, I worry how much longer it's going to take. And bring it back to impact is having a huge impact on us, having to continue to fight for this right, for our loved ones, for everyone that's in care homes, and for potentially any one of us in this room could end up in a care home for any sort of reason. So we're protecting the future rights for everybody as well. But I'm optimistic about all the interaction we're having, but if you're asking the pessimistic, why is it taking so long, would be...
And do you have any indication as to the progression of Anne's Law? Do you have any indication when it may be coming?
Well, it's tied to the National Care Service, which is currently paused. So hopefully they will bring the NCS back on. They have said that once the NCS is passed, it wouldn't take long to implement, but they're implementing something which, as it stands at the moment, isn't acceptable to us. And so unless we get changes to the main legislation, I don't think we've achieved what we set out to do.
And I think whilst we have the new care standards in place, that we don't really hear of people being locked out anymore. But my concern is that because of the short time that people live in care homes, that there's not many people in care homes today that lived through the height of the pandemic, and that people don't know about their standards. So you're relying on families challenging decisions and being aware of these. And we don't think at any point the guidance has been made fully available to families in a way that's meaningful to them. It was my mum's care home that was shut down on Christmas Eve in December last year, from a locum public health consultant making a decision. And there was my mum's home is a 40-bed home, and it was only her floor that was closed, so there's 20 beds. There was 19 families locked out that day, and I got in because I knew the rules, and that just shows you who didn't know the rules and didn't know what they were entitled to. And I wrote to Kevin Stewart, and I have no doubt that he went through public health because of their decision, but he called it a blip. I don't think it was a blip. I think that could be happening up and down the country quite easily, but people just don't know what they're entitled to. So it needs to be enshrined in law so that there isn't blips or there isn't local public health consultants making a decision on a whim.
That's right, and the reason that we would be unhappy to just settle for the care standards was that there were existing care standards during the pandemic, and they didn't help us at all. And they did have lots of things there which should have ensured that that your opinion is, if I'm in care, that my views are always taken into account. There's a whole list of things there that, had they been applied, what happened to us and our loved ones wouldn't have happened.
And I think since the day we started campaigning, we've highlighted the fact that there's actually no place, no body, nowhere to go if a relative is looking for advice or guidance. I mean, there's the care inspectorate, but they're kind of seen as they police the standards. And this is we're having ongoing talks about this because they were keen for our group to take on this role, and we're like, no, that's not what we're
not
here
your
for.
role.
But no.
Just before you leave Anne's Law, can I ask a question which I admit is of detail, but nevertheless is quite interesting? Am I right in thinking that the way you envisage Anne's Law provides for an essential caregiver, one person?
Yeah, sorry. No, you go.
Oh, yeah, because in a different context, we've heard evidence from the lady that gave evidence this morning that, I think it was in the context of funerals, if you've got 6 relatives, or 10 relatives, and you've got 6 at a funeral, how on earth do you pick them? It's invidious. I can envision circumstances where a family person has got lots more than one relative who's a potential caregiver. You agree with that as a matter of fact?
Yes, that's right.
Yeah. Now, I'll keep on talking for this time. If what you tell me about infection control, and if what the lady that wrote the letter that we saw from the Nursing Times, or to the Nursing Times, is correct, then proper infection control, properly applied, should mean that there's no reason to have simply one caregiver, essential caregiver, as long as they're provided with whatever the essential infection control measures were, then the whole family could be essential caregivers. Is that not correct?
Well, there's 2 parts to this.
Shouldn't you be modifying Anne's Law to say that?
The first part of it is that during the pandemic, where essential was for end of life, then more people would have been allowed in. Where it was known about in the early days of the pandemic, nobody knew that they could get essential. But later on, as it became, people became more knowledgeable about the right to essential visiting for end of life, then that could have been larger numbers, not just...
Yeah, because you're actually proposing something that is going to, the minute someone goes into a care home, that right exists. But I'm just wondering, why are you trying to confine it to one person? It could be more.
It's for pandemics, for major outbreaks where public health are determined to reduce footfall. It's basically a plea to say, please do not reduce footfall below the one person. We weren't seen as husbands, wives, lifelong companions. We were seen as vectors of infection. That's all we were to public health. And that's why we have said, please God, allow at least one person in.
Yeah, but so on the back of what you're saying there, I totally understand what you're saying. But I think to highlight is it shows how worn down we are as families, that we're still 3 years down the line fighting for a law to allow one person, we're almost maybe scared to, can we up it to 2? Can we up it to 3? So we can't even get the basics of people to back us to allow one person in. We don't want to push our luck.
Yeah.
And
But the logic of what you're proposing
yeah.
would drive me to think that your argument would hold good, if it is good, if it's more than one person.
And I think this is the thing we would have to convince public health. So we feel, well, at least if you will, at least...
Got to convince me in the first place.
I mean, in the worst, you know, the worst pandemic, the worst scenario, there will still be that husband will be able to visit the wife, that there will be that one important person, so that it never drops completely, that there's nobody going in. So that it's like the safety net.
Yeah, I'm not sure you're quite getting me. I'm not suggesting that, for example, say you've got, forget the husband and wife, you've got two sons, or son and a daughter, 2 daughters, whatever, 2 people. It's a bit invidious to pick one over the other. I'm not suggesting both of them go at the same time.
Yeah, but common
both
sense
of them
would
could be
say-
nominated and they could go
So that
one
is,
at a time when they wanted.
So that is part of what we proposed as well, that although we're saying one person, there should be 3 people that are nominated,
Yeah,
but then we
that's
should
better.
rotate it. So that is in what we proposed,
Right.
but only one person, like we're saying, because we're very understanding under extreme circumstances, we need to try and protect everybody, but only one person goes in at a time, but there is the option for it to be 3 people that can be rotated on a basis, so we have...
A number of people
Yeah.
can be nominated as essential caregivers.
Yeah.
Fair enough.
I think I know that's very interesting. To a certain extent, restricting it to one person, did you feel that in the way in which you were campaigning that was perhaps what you could get away with?
I would also say that on the back of restricting it to one person, we have to bring it back to the care home residents. So at the time where we were possibly speaking about it, we're always talking about the impact on us, but care home residents were just locked away from all their family. So in our heads and minds, we were possibly thinking, well, if we could at least get care home residents to have one person, that allows that care home resident to have access to their family. They were shut off from everybody, so we were just starting from the bare minimum to try to help all those residents.
Yeah, I think the bare minimum is, I think, encapsulates that, doesn't it? Yeah. Just a few other points, if I may. Can I take part of your statement on interaction with families as read, because we can look at that. If we could go to paragraph 57 in your statement. You mentioned CHRS Lost Loved Ones group, and you briefly explain the purpose of that. Could you just again explain why that group was set up?
Yeah, that group was set up because when Open with Care came in February 21, in the March, a lot of care homes did start for the first time in-person visiting, and people were posting a lot of photographs or selfies with their loved one, you know, for the first time. And people a lot of people in the group by then, as I say, by then 15,200 people had died in care homes, of whom about a fifth were from COVID. And so we had loads of people in the group who'd already lost their relatives, and they were finding these photos, although they were really happy for people and they were really pleased to see it, they were finding it difficult as well, and they asked if they could have a separate group.
Right. Can I take you on to your concerns at paragraph 59 and onwards? I think it may be just useful if one or other of you reads that section from 59 onwards to the end of your statement.
The government failed to recognise the need for at least one key relative, such as the husband, wife, mother or daughter, to be given essential caregiver status. We believe that essential caregivers, using all the same mitigations as staff, including PPE and infection control protocols, could have ensured their loved one was supported and kept in touch with their wider families throughout the pandemic. Close relatives, desperate to see their loved ones, were made to feel like the enemy when they should have been welcomed as part of the care team. The Scottish Government failed to provide clear direction to care homes and failed to insist that guidance was adopted and followed. This was despite the fact they laid down the rules in every other sector of society. They claimed they had no levers to do this in care homes, but this could have been achieved by amending the care standards much earlier, or explaining that payment of fees or personal care allowances, which go direct to homes, would depend on them implementing the Scottish guidance. The government failed to ensure that care home residents benefited from the route out of lockdown. Instead, they had no access to services such as opticians, podiatry, hairdressing for more than a year, and they were unable to get out in fresh air. It was 7 months after the Chancellor's Eat Out to Help Out before care home residents were even able to go for a walk or a run in the car. As a group, we felt that we had no way to challenge these decisions, even though we were sure they were unlawful. When your rights are being challenged to this extent, there should be some way to access justice. We felt many others paid by the public purse to protect the interests of vulnerable people failed to speak out on behalf of those in care homes, such as directors of social work and the Office of the Public Guardian. Imprisoning people for a year and isolating people in small rooms for weeks on end should have been challenged. The Scottish Government and their public health advisors failed to recognise the huge impact their policies were having on older people who were approaching the end of life even without COVID, and the impact that such long periods of isolation and confinement were having on the entire care home population, which includes a substantial number of young adults. The Scottish Government were able to create an impression in the press and media that indoor visiting had restarted, but in huge areas of Scotland it continued to be heavily restricted, with only closed window visits or outdoor visits available. Many people in Greater Glasgow and Lanarkshire areas had no direct contact with their loved ones for a full year. The Scottish Government have never said sorry for what relatives of those in care homes have been through. The needs of young adults in care homes were ignored. When Public Health Scotland produced a final set of COVID guidance in January this year, care home guidance had been amalgamated with the guidance for prisoners. This was only changed after complaints from our group. Any one of us could end up in care, and lessons must be learned so that this never ever happens again.
Thank you very much, all of you, for engaging with the inquiry and providing your statement and your evidence today. I will always ask, or should always ask, anyone who gives evidence to the inquiry if there is anything you feel you want to add to what you've already said, and also to say that if at any time after you leave this room it occurs to you that there was something that you should have said or would have liked to have said, please let us know, contact the inquiry team, and that information will be added to your body of evidence that you provided. So is there anything further that you would like to add?
Yes, please. This session is on the impact, and the biggest impact we felt from our members was the survey that we carried out following the change of guidance in October 2020, which allowed 4 hours with touch. We surveyed our members to quantify how well these were being implemented. We included a free text section for people to include how the restrictions were impacting them, and we received 322 impact statements, which include 165 mentions of stress, anxiety or depression, 100 mentions of guilt or worry, 59 mentions of sadness, abandonment or hopelessness, 49 mentions of heartbreak, heartbroken and grief. It felt that every time there was progress in terms of access to care home residents, another obstacle appeared. We would often hear, "We can't trust you to do your own tests. We can't facilitate visits with touch. We can't facilitate video calls. We can't have Christmas decorations. We can't accept Christmas presents unless they're quarantined for 72 hours. We can't have hairdressers. We can't use rapid testing since we haven't had training. We can't alternate visitors. We can't give you an extra visit even though visits are going unused. We can't let you push your wheelchair. We can't facilitate outside visits if we haven't bought any heaters for winters. We can't give you an essential visit as we'd have to give everyone them. We can't allow you access to your relative's room. We can't let you see your dying relatives for more than 15 minutes a day. We can't let you hold your dying relative's hand. We don't trust the Scottish Government decisions. Guidance is only guidance, we don't have to follow it. Public Health say no, Care Inspectorate say no, Social Work say no, the Manager says no, Head Office says no. But we can test you, dress you up in PPE and make you sit behind a screen 2 metres away from your hard-of-hearing, non-verbal relative for 30 minutes once a week and then tell you your time's up. In early 2021, we joined forces with family groups in England, Wales, Northern Ireland and the Republic of Ireland, calling on governments of the 5 nations to act, and we still stand by this today. And we'd like to mention our partners in Care Champions in Ireland and Rights for Residents in England, because we know they're watching today, and they're campaigning for a law of care partner in Ireland and Gloria's law in England. After a year of fear, distress and countless separations, family members from our 5 nations want to reassert the larger picture of what a society should be. Over the months of the pandemic, the deepest ties of love, the things that make us glad to be alive, have been treated as unimportant. Spouses, life partners, parents and children have been treated as inessential to each other. Their wishes have not been considered. Their voices have not been listened to. Residents of care homes have been shut in, and those who love them have been shut out. People living in residential and nursing homes, for whatever reason, have been treated differently from the rest of society. They have had no agency. Those who have been trusted to speak for them have not been properly listened to. Their well-being has been compromised in the name of care. This is not the society we wish to pass on to the next generation or grow old in ourselves. The test of a democracy is how it gives respect and choice to all of its members, young or old, in health or in sickness. Love is the bedrock of a good society, but hundreds of thousands of people, those bonds of love, have been cruelly disregarded. As members of our individual nations and as fellow human beings ourselves, we call on our governments and everyone with influence to assert what is inalienably right for all of our sakes.
Thank you very much, Ms Leach. Thank you very much to all of you. We are very grateful to you.
Thank you.
I share those sentiments. Very good. We'll adjourn now.